First, when we talk about young people, we divide it into two categories. The first category is prevention. Prevention is when you are not seeing any signs of aging, but you want to prevent the onset or delay it slightly. You would start from 18 up to 25. Then you have the second category called early intervention. This is slightly mature groups. We're talking about people from about 25 to 35. These individuals are beginning to show the early signs of aging. For example, pigmentation, lentigines, or maybe fine lines around the eyes or the glabella or forehead, or maybe a little bit of sagging around the lower face. And these individuals, you want to give them a little bit of support and bring them back to a much more youthful state. So you're trying to bring them into the prevention state. Right, so for the younger generation, we work with the skin. With the skin, you can use light and energy-based devices as well as chemical peeling. Superficial peels like alpha hydroxy, beta hydroxy, Jesner's peel, or even TCA are wonderful. You also combine different medical skincare on the skin, and of course, stopping smoking or reducing smoking if that's possible. Now, when it comes to the muscles, we recommend the use of botulinum toxin. So Xeomin or Bokuto is a wonderful example of a product you can use in areas which are hyperdynamic. So if somebody is expressing a bit too much, you may want to start earlier to control this habitual overexpression. If you see very large muscles, you also want to treat them earlier on. Now, when you move deeper down, you're talking about the fat, the ligaments down to the bone. This is about volumization and also energy-based devices such as L-therapy. Here, what you want to do is volumize areas that are beginning to sag downwards, and you want to work with the ligaments to give them a little bit of support.
We can do many things to prevent aging. It always depends on the individual type of the patient. Someone who is having a very active mimic, of course botulinum toxin, and especially Bokuto as the purest toxin in the upper face, is the best option because we can really prevent the appearance of the mimic wrinkles. If I rather have a young patient that doesn't have really a mimic appearance, but because of the genetic predisposition have a deep tear trough, then of course this is a kind of like a beautification, not really prevention, but of course these tear trough will also not get deeper to the infraorbital hollows, and we can use fillers. And if we have these full faces with already initial sagging and the patient just want to narrow their face a little bit, we can use, for example, very efficiently L-therapy. I have some patients who are really end of 20, begin of 30, and it's not really to lift this material, but they have just heavy tissue and they want to have a little bit more V-shaped face, and without adding much more material into their face to make them looking blown up, because that doesn't look good, we can narrow their face.